family and for those children that are living within that family. So in terms of this finding, it highlighted that simply naming domestic abuse as a concern for a child isn't enough for practitioners to understand the situation and be able to assess the level of risk and respond appropriately. The Domestic Abuse Act received royal assent back in 2021 and identifies 5 types of abusive behaviours that can be used by perpetrators of domestic abuse towards victims and survivors. And those categories, some of you may be familiar with them already, are physical or sexual abuse, violent or threatening behaviour, controlling or coercive behaviour, economic abuse, and this was changed from the previous definition, which talked more specifically about financial abuse, whereas now economic abuse encompasses financial abuse, coercion, control and harm, but also other means of depriving someone of access to finances or means of accessing money that they need, and then psychological, emotional or other abuse. And with this in mind, when we're working with families in light of the briefing findings, stating that practitioners should be able to detail and describe the type of behaviours that are being used by the perpetrator, the abuser within that circumstance, and not just state domestic abuse as the concern. The report also found that sometimes there wasn't clarity in reports of the direction of the abuse. So the DA Act talks about that language around the perpetrator, so the person who's causing the harm, and then the victim, survivor of that. But this report found that in some cases it wasn't clear who was using abusive behaviours and who was the victim. And what it had led to was responses by practitioners that inappropriately made both the mother or both parents equally responsible for the risk. And so it also highlighted that while sometimes there are situations where both parents or carers do pose a risk to children, they are relatively rare. And in the context of domestic abuse, there is usually one primary perpetrator, primary victim, although that can be sometimes hard to kind of recognise who is doing what to who. But it's really important that we identify dynamics of a relationship, dynamics of the domestic abuse, so that we can really understand the risks to the children. The other thing in terms of the Domestic Abuse Act that's really important is that we now have recognised children as victims of domestic abuse in their own right. So the Act recognises that children who see, hear or experience the effects of domestic abuse, so abuse that is being perpetrated or targeted towards someone in a parent role for that child, they are now victims of that domestic abuse in their own right. We know that that has implications for safeguarding practice, and this review analysis found that the concerns for children within reports were often categorised as emotional harm or neglect rather than as direct abuse from the perpetrating parent, and often actions were very focused around the mother, who in many circumstances was the non-abusive parent. So the non-abusive parent changing their parenting or placing responsibility on them to keep the children safe from the behaviour of the perpetrator, rather than identifying that the children were actually directly being harmed by that abusive behaviour themselves. And then once we can understand the abuser's behaviours and the direction of the abuse, we can have a much clearer picture of the risks and therefore then the impact on the children. It also links to just that thinking about children's daily lived experience of the domestic abuse, and Tony's going to talk a little bit about children's voices later, but just to think about domestic abuse, when we think about that, the definition, not just about physical abuse and physical harm, and that children experience on a day-to-day basis if they still live in the home with the domestic abuse, or even after separation, experience all forms of domestic abuse. And we need to be thinking about and understanding that behaviour from the abusive parent or carer and how that impacts not just on the child directly, but also on the non-abusive parent's ability to be responsive to and meet the needs of the children. The other thing I guess that's key is really around this is that children living in that same environment can respond very differently to the trauma of the abuse, but that we should always be keeping responsibility for the harm with the parent or the carer who is the person who's causing that harm, the abusive parent.
Okay, thanks, Karen. Radlama, do you want to take us through the next finding?
Yeah, the next finding is about they found out that there was no whole system approach and multi-agency working was only evident in cases where deemed as high risk from the MARAC, and the ability to coordinate and ensure responses to children was not evident. So tackling domestic abuse and violence against women and girls requires a whole system approach, which enables all members of the society to be part of the solution and take action, which has proven to save lives. Research and many reports have shown that greater collaboration and coordination between and within an organization is crucial to reducing the prevalence of domestic abuse. Because each agency know what they know, they don't know what other agencies know. And this is where opportunities are missed to identify victims and survivors and perpetrators sooner. And also sharing crucial information about victims and survivors can help tailor and improve the support they receive, the victims receive. In Barnet, there is significant amount of work underway to improve the response to frontline staff to domestic abuse for all agencies and to promote multi-agency responses and best practice. Today, I'm going to highlight two of the good practice examples in Barnet, the MARAC and the Domestic Abuse One-Stop Shop. The MARAC, for all those who don't know, stands for Multi-Agency Risk Assessment Conference. Is a meeting where it's held every week on a Wednesday where information is shared on the highest risk domestic abuse cases between representatives of local police, health, child protection, housing, independent domestic violence advisors, whom we call IDVAs, probation, and other specialists from statutory and voluntary sectors. After sharing all the relevant information that they have about a victim, an alleged perpetrator, or children, those representatives discuss options for increasing the safety of the victim and turn this into a coordinated risk reduction action plan. The main focus of the MARAC is to safeguard the adult victim, but the MARAC will also make links with other agencies to safeguard children and manage behavior of the perpetrator. The victim does not attend the meeting, but is represented by the IDVA who speaks on their behalf. In the review, 17 out of the 72 reviews, at least 17% only, reference MARAC, and it was noted that the ability to coordinate was not evident. As Karen explained earlier, with the DA Act, children or victims in their own right, victims of domestic abuse in their own right. And we will ensure, this will help us to ensure that locally commissioned services consider and address the needs of children affected by domestic abuse. We encourage here good practice in the identification of children affected by domestic abuse and provision of protection and support for those children. For example, in Barnet, in the one-stop shop referral form, assessment form, or even in our advocacy service, we ensure that all those commission services consider and address the need of children as well. We have the Barnet MARAC referral, which we are going to put in the chat. It's an online referral form where practitioners can refer high-risk cases of domestic abuse. There is a risk identification checklist of 24 questions, and there are specific criteria where there are visible high risk if they tick yes on 14 questions, or they can have professional judgment, or it can be escalation of abuse through call-outs to the police, through the number of call-outs to the police in the last 12 months. And repeat, you can also have repeat victims. If it's the escalation, there is escalation for the same victim and same perpetrator. But we should not undermine the low and medium risk cases, as they can potentially escalate to high risk if not intervened earlier. We have our own advocacy and support service, Solace, where they accept referrals. You can call them for advice, guidance, support if you're not sure. And they can also, if the case is low risk and escalate at any time, they will send it to the MARAC. We have a very good practice here in Barnet called the Domestic Abuse One-Stop Shop that is held every Thursday morning, 9:30 to 12:30, where it is a free advice and drop-in service. You don't need an appointment, and it's for all men and women, for all genders. Our partner agencies are we have 3 solicitors, family law and immigration solicitors, a housing advisor, antisocial behavior officer. We have our IDVA there. We have welfare benefit advisors and specialist organizations like Jewish Women's Aid or Asian Women Resource Center. They can all meet them under one roof at Collingdale every week. And they will provide advice, information, options, support, and do the risk assessment and safety planning to support them. In Barnet, following a domestic homicide review, there was need to train our general practice, our GP practices in Barnet on domestic abuse. And since 2017, we have the IRIS program, which is a specialist domestic abuse training and support to increase referral to our advocacy service. And we have improved as well since then. Since 2017, we now have an IDVA within Children Match and early help and children's social care. We also have co-location in Barnet. We have one at Barnet Hospital, run by Victim Support. We have one IDVA from Solace in mental health, one at police station, and at the one-stop shop and others. So these co-located IDVA also help with the multi-agency responses. So we therefore, I'm going to put the link on the link for our website with all the contact and so on in the chat, so that all the contact details on our website. So we hope that they can be used for multi-agency working, and within each organization, there is also a MARAC lead where you can ask advice and help if you're not sure if this is a high-risk case or not. But also for low and medium risk, Solace is there, and the one-stop shop, you can always drop in without appointment.
Brad Lama, that's amazing. Thank you for that really comprehensive overview of our system in Barnet. Please do put that information in the chat box.
Yeah.
And your contact details are at the end, so people can drop you a line. Thank you. I just want to move on to the next finding. We're about halfway through the slide pack, so over to you, Karen, for the next area.
Great, thank you. So yes, another finding was around there being an overemphasis on domestic abuse and physical violence as the primary indicator for that abuse, and as a kind of a basis for assessing the level of risk posed by the abuser to the children. But when we look at the Domestic Abuse Act definition that I've already briefly talked about, that overemphasis on physical violence, the findings included, meant that non-physical incidents of domestic abuse were often viewed as low level, less risky, less of a concern, and therefore then the risk attached to those types of behaviours was not responded to appropriately. Some key things around this. So we do have a reducing parental conflict programme, and it's a national agenda since 2017. Department for Work and Pensions has been working with councils across the country around parental conflict, and the idea of that programme is around strategies, program support for approaching, identifying and supporting parental conflict, which is below the domestic abuse threshold. There's training attached to that program, which is available in Barnet, which helps to recognise within a family circumstance, is this parental conflict, or actually are there elements of control or abuse that actually means that it is not parental conflict, but it is domestic abuse. So we do have that program, and anyone who oh,
you put your microphone on mute if you're not speaking. Cheers.
And if anyone would like further information about the Reducing Parental Conflict program and agenda, then please let us know. We can put you in the right direction. But the key thing about that program is that it adopts a safety first approach, and it encourages practitioners to look for indicators of abuse and coercive controlling behaviour in particular. And if there is any evidence at all of domestic abuse, coercive control, then the parental conflict pathway wouldn't be appropriate. But of course, what that also means is that as practitioners, we need to be in a position to be able to identify that coercive and controlling behaviour. We also have multi-agency training specifically around that across the partnership that people can book onto as well. Key things around this and this seeing all forms of domestic abuse as potentially risky. So coercive control was identified in 65% of DHRs when the Home Office Quality Assurance Panel looked at 124 DHRs for the 12 months from October 2019. So coercive control was a significant indicator of risk in terms of the adult victim survivor's life being taken by the perpetrator in the context of that domestic homicide review. We know that coercive controlling behaviour occurs during the relationship, but also if there is afterwards, if there's been any separation. We also know that that point of separation and afterwards can increase levels of risk to the adult victim survivor, and the children can also be used as tools to control or continue to intimidate the adult victim after separation. And so that point of separation or the lack of being in the same home should never be seen as automatically reducing any risk to children. Some coercive controlling perpetrators use no violence at all. They don't need to use any violence at all when the tactics, behaviours they're using are leading to them having that power, that control over the victim survivor. And children living within this context are therefore also at risk of those behaviours. There's some research by Emma Katz. She very much is trying to look at filling that gap around our understanding around coercive control. And she quotedly quotes, children's and adults' experiences of coercive control are so similar that children can best be understood as co-victims and co-survivors. And so when we are identifying coercive controlling behaviour, we need to be thinking about the possible risk attached to that, but also the children's daily lived experience of that as a victim in their own right, as I mentioned earlier on.
Great. Thanks,
Tony.
Yeah, cheers. Okay, just pass back to me just to kind of go through what's on this slide. So in the sample of cases that the national panel looked at, they tried to tease out the impact of abusers' behaviours on children, and therefore what did you see? So what were some of the safeguarding issues? And they kind of separated it through pre-birth and babies. So in instances of those children being involved, there was always, from the evidence, deliberate harm, physical abuse or accidental harm, and co-sleeping was a real prevalent factor in those children's instances of serious harm or fatality. So co-sleeping, safer sleeping, police sometimes say overlay. If you're addressing these issues, you should be ringing alarm bells. Kind of what else can we see through our assessment? So that was a really important thing to flag in the briefing. Preschool age, very similar to babies, but also that included cases of non-fatal neglect. You would have seen at the back of the pandemic a number of high-profile national cases, where that's been a feature. In causational link to that has been domestic abuse for a number of the cases in the sample here. primary school age children start to see other safeguarding issues, sexual abuse, communication and learning difficulties, unidentified needs. They're key factors that the national panel see. And then later on for adolescents, tragic instances of children taking their own life. And then you start to see the, intrafamilial harm, criminal exploitation, sexual abuse, and so on. So the impact of abusers' behaviours on children and young people equals some of these things here on this slide. So I just thought it was a really important part of that briefing paper to tease out. Just going to finish off some of the findings before we move to a couple of recommendations. The sample of those cases also found, really kind of weak assessment and recognition of children's voices and the experiences of services. This is a message that is almost now a kind of constant perennial message. And they gave an example of an actual incident of an 18-month-old baby who was shaken so badly that their injuries led to lifelong disabilities. Mother had started a relationship with a known high harm domestic abuser, a perpetrator, and in previous sightings, in this instance by police, it was recorded that the children seemed well. So what the national panel is saying is that multi-agency partners have to challenge each other on these generic statements. What do they mean? What do you mean seem well? What do you mean they appeared fine? There was food in the fridge. What does that mean contextually? And the national panel are almost frustrated that they see this time and time again following serious safeguarding incidents. Just kind of to conclude the findings, COVID-19, it kind of goes without saying, that it seems that we had a government run over WhatsApp, making decisions, and the impact of that on children for too many vulnerable children has been profound. So this sample of cases, found that this was a factor as well. So, something to think about there. Right, so we're about halfway through. So I just want to focus on a couple of recommendations because I want to open up the virtual floor for the last 10 or 15 minutes for any kind of comments, thoughts, or reflections. Rachel, I don't know if you, Karen, sorry, I don't know if you're able just to pick up on this one around the domestic abuse plan and linking closely to local arrangements.
I will focus on this.
Radnama,
I will focus on this. Yes, this finding is about connecting closely, safeguarding partners to connect closely with our domestic abuse board and ensure priorities and work plan align, including commissioning and budget priorities and clear accountability mechanism. In Barnet, as you know, we have the domestic abuse work team whose remit is to work in partnership in a whole system approach to prevent and respond to domestic abuse. We have a domestic abuse and vogue strategy developed for 2022 to 2025, which sets out our vision for Barnet to be a borough where everyone can live free of domestic abuse and violence against women and girls. We have 5 partnership objectives where they focus on early intervention, prevention, support to victims, pursue perpetrators, and strengthen our partnership response and working together for safer street, community, and public spaces. And following for the implementation of the strategy, we have a comprehensive delivery action plan that we report on a quarterly basis on a set of partnership indicators that measure success and outcomes, again, the objectives set in the strategy. Our governance structure in Barnet is that we have a vogue delivery group or board where all partners at senior or director level meet on a quarterly basis to ensure a robust, coordinated response to DE and vogue across the key strategic partnership agendas to plan and make decisions on the effective use of resources in Barnet. We have the Vogue Forum as well, where all practitioners and those working in the area of DA and Vogue meet on a quarterly basis to share good practice, share experiences and knowledge, and work on the challenges facing the boroughs on DA and Vogue matters. We have rep from the Safeguarding Barnet Partnership team. Actually, Tony Lewis is represented at our Vogue Delivery Group and our Vogue Forum. And that makes a difference in working in a whole system approach, and that our child safeguarding partners recognize the central role in our local response to domestic abuse. We have been discussing actually about new models and approaches such as the Safe and Together model, which work in a host family approach as a good practice. In the review, it was found in most areas, mutual accountability for domestic abuse and children who are victims varies greatly across England. In Barnet, we are more and more collaborating and have stronger relationship with the Barnet Children's Safeguarding Partnership.
Another one that, yeah, now she's
to promote prevention work with children and young people and improving our responses. We also collaborate more in addressing gaps in data and knowledge on domestic abuse to improve our responses. We also, following a homicide, a domestic homicide, we have a statutory domestic review that is conducted, and we have learning lesson. It's not to point fingers at any agency, it's to learn where we've gone wrong, how we can improve, and we share those learnings through seminars, through webinars and workshops to discuss the implementation of these learnings in our work. But there is more action needed to better understand suicide that follow domestic abuse. There is guidance from Home Office to say that the presence of domestic abuse in a relationship of a person who has died by suicide is enough to trigger a DHR. And to learn the lesson. Unfortunately, in Barnet, so we will take measures to improve our understanding as well as our response to suicide that follow domestic abuse. In Barnet, we did not have a DHR on suicide following domestic abuse, so we want to learn a bit more and improve our understanding so that we know whether we are really responding to the needs of the statutory guidance. So thank you. Over to you, Tony.
Thanks, Radlama. I'm just going to jump a couple of slides on to slide 13. And to everyone that's on the call, we will send these out. So please put your email address in the chat box if you want them. And Radlama, I think this was also one of yours to pick up as well around training. So if you can go through this one with us. Yeah.
Yeah, training as well in Barnet as a local authority. We always invest in awareness raising, specialist training within our services to ensure that survivors receive effective and safe responses, and that information about the services reach the range of different communities and protected groups in our areas. For example, this financial year, we've run MARAC trainings, we've run half-day training on DA Vogue awareness, a full day on level 2 training, we've run half-day training, 1 per quarter on coercive control and economic abuse, and some webinars and short awareness program. So this year, every year, we do a needs assessment so that to understand what training suit best for our borough. So I will make a call to all practitioners present here. We are currently doing a training needs assessments so that we understand better what type of training frontline practitioners need on domestic abuse, their availabilities and type of training needed. So currently, I will circulate this very soon about this training needs assessment so that next financial year, we hope that the training that we organize will meet the needs of the frontline practitioners. So the response to domestic abuse is a very complex one that spans several statutory and non-statutory agencies, but not limited to local authorities. And we invite drug and alcohol agencies, specialist police and criminal justice system, wider organizations such as employers and financial services also have a role to play. And this is where we want to reach those wider organizations, so that employers and financial services. So it is vital to appropriately safeguard training, including children, regardless of the level of risk. So training is very key to be able to sort of implement in your work. The review also recommended that the domestic abuse informed response is provided by all practitioners, and this is supported within supervision and reflective practice opportunities. So we'll work towards making sure that this is also supported within supervision and reflective practice opportunities in Barnet. So thank you. Over to you, Tony.
Thanks, Red Llama. Okay, so final slide, just in conclusion, in terms of sort of final recommendations within the briefing paper. It really stresses the need to be fully invested in working with all partners. I think, as Red Llama has eloquently put forward, but also just as a kind of closing note, it loops back to making recommendations such as new child protection practice framework, national standards. A number of these issues got pulled into the government's social care reform review paper that was published a couple of weeks back in February. So much of the issues that this briefing paper highlighted has been considered within that, particularly around family networks, kinship care, where children can't remain within the family home. These are all factors that have been considered and will be considered going forward. So look, it's a lot. The briefing paper is around 20 pages. It's actually quite an easy read for obviously a significant issue that we face in society. So do have a read. We're going to just kind of open out to any questions or queries. I think for me, the finding around breaking down those instances of children under the age of 1, preschool children, secondary school children, and some of the safeguarding issues they were experiencing that were underpinned or causally linked back to domestic abuse. That is incredibly illuminating. So do have a consideration of that in your own practice. And that draws this part to a close. I just want to see if there's any hands up. Does anyone ask any questions? Because you've got Karen and Red Llama here. Any reflections or queries at all? Annette, yes, Annette, I saw your hand up earlier. Thanks, Annette.
Yeah, I was I put that on too soon. I think it's really great work that's happening in the borough. What I wanted to know is we are seeing a huge majority of cases where there's obviously domestic abuse, post-separation abuse, is parental alienation. We have countless young children who are living with the perpetrator where there is parental alienation, they've been removed from mums, and these children are voicing wanting to take their own lives. Ongoing issues within the family court, which is hugely lengthy. Is Barnet in a position to provide any support around understanding how we can work with parental alienation, because there's so little out there? So as a DA agency, we're constantly looking at how best to support parents, practitioners and other agencies. So I just wondered, with everything that Barnet puts in place, is there anything that they know that's going to be available in the future around parental alienation?
Thanks, Annette. Michaela, I see your hand's gone up. Is that in response to Annette?
Yeah, it was.
Yeah.
I mean, it's only minimal, I'm afraid. So I'm the lead on reducing parental conflict programme in Barnet, and the majority of the resources for that budget are for low-level preventative work with reducing parental conflict, but there is a little bit of money that's at tier 4, which is the kind of families where there's more high level parental alienation, parental conflict. So the Tavistock relationships have been providing some training for social workers and early help practitioners around their mentalisation approach. And there's another 2 training sessions booked for March, training upskilling social workers and early help practitioners in being able to look at some of the kind of evidence approaches that are used by the Tavistock, which is helpful. Unfortunately, we don't have the funding in this borough to buy in some of the programmes that places like the Anna Freud and Tavistock have run for boroughs that have had, you know, kind of enhanced funding, because I know that there are programmes that are run where there's higher levels of parental conflict, but we are trying to upskill our workforce around the mentalisation approach, if that helps.
It's really difficult, isn't it? Because it's social workers and health practitioners, as you say, that are going to be able to access that training.
Yeah.
What we're trying to find out is what training can we as DA frontline practitioners access. Because we also, I mean, I love the fact, Radlama, you mentioned Safe and Together, and I don't know if Barnet's actually going to go through with that model, because that I think would be really helpful, because actually we have a lot of families that are working with the local authorities, not just Barnet, where there is parental alienation. And if the local authorities aren't able to recognise the domestic abuse, we have a lot where they're colluding with the perpetrator. So these women are in a catch-22. So yeah, it's really challenging, really challenging.
Right, Michaela, thank you. Karen, I think you might have further comment as well.
Yes, I think key thing around the terminology around parental alienation. I know on the CAFCAS website they've changed it to alienating behaviours, and also that there's some kind of strong narratives around that term. So I went to a session with Emma Katz, who does a lot of research around coercive control, and what she was advocating for is that when we see alienating behaviours post-separation, and we know that domestic abuse is a factor, so we know that coercive control was happening in the relationship, that actually, are we better, she was proposing, are we better to define it as post-separation coercive control using the family courts, using practitioners, professionals to further abuse, control and harm the victim. I think certainly, I see Radlama, your hands up. It's something that has come up at the VAWG forum. It has something that we have discussed. So I think in terms of training needs and in terms of looking at the Barnet approach, there's probably a couple of things we can do around that. One is when you get your training needs assessment from Radlama, pop that on there. You know, we really want to know what training needs are, but also we could look at working with Michaela and others to look at a Barnet approach to kind of addressing it and scope, you know, looking at it in a little bit more detail. So yeah, that's just what I wanted to add. Thank you.
Thanks, Karen. And Radlama, did you want to come in there as well?
Yeah, just quickly. Thanks, Annette, for this question. And that's what I want, the needs of the borough. And you raise a very important need. And we will, once I send my trainings, just make sure you put it, and then we'll look at it. We'll look for funding. And also on the Safe and Together model, we are working hard to have this in the next financial year. We are looking at funding, so I can't say anything for now. So until we receive the funding, then but we are working hard to have the Safe and Together model brought to Barnet. Thank you.
Thank you, Radlama, and thanks, Karen. And I think a Safe and Together model is, if we can get the money, I think that will enhance our borough, the local authorities' practice, and it will make a huge difference to the families that go through child protection and child in need, for sure.
Yeah.
I know the model, I know I've been trained on it, and I really hope we get that funding. Thank you both.
Yeah.
Thank you, Annette. Thank you very much. Okay, any other questions or queries from anyone on the call? There's me racing through, and we got one question from Annette. Thanks, Annette. Do you want to do, Red Llama, whilst everyone's here, do you want to do any kind of updates on the plans for International Women's Day or anything forthcoming? And would that be useful at all?
Yes. Yeah, I can do an update. So as you know, 8th of March is International Women's Day. The theme that the UN is about innovation and technology this year, but Barnet has a local theme. It's about empowering and about inspirational women in the borough. We have a day event from 10 a.m. to 2 p.m. at Saracens. Invites were sent to everyone to register on the Eventbrite, and I hope to see you there. We'll have stalls. We will have very good speakers and other singing and performance and musicians. So we hope to see you. It will be a good day to celebrate the inspirational women in Barnet. And we also have the one-stop shop, which has gone back face-to-face. So there is an official launch on the 9th of March, on Thursday, 9th of March. But this is, I make a call as well when you want your client, your survivors or clients to be referred, they can just drop in every Thursday. There is a wide range of specialists there, from solicitors to boost to welfare advisor to housing advisor, all in one place. So make use of this one-stop shop where it's for domestic abuse, that's the only place where they can drop in without any appointment.
Amazing.
And also we are also going to visit our women's refugees residence as part of the International Women's Day.
Thanks, Red Llama. Thanks for giving us an overview of that. Just from myself before we conclude, I'm going to put in the chat box promotion of our new bruising protocol for mobile and non-mobile children. These issues are linked and overlapped. You might remember at the start I mentioned there was another briefing paper put out by the National Panel on bruising in mobile and non-mobile children, as it's seen as a stubborn challenge in the system. And they were clear of the links to domestic abuse. The chat box has the link to the new bruising protocols for mobile and non-mobile children, which brings clinical best practice into up to date. And we're doing some further webinars on those protocols, and the dates for that are in the chat box as well, so you can copy and paste them into the respective date and time on your calendar, and hopefully you'll come to that. We're going to be joined by Paul de Keyser, who some of you many of you will know as a designated doctor for safeguarding, as well as Caroline Loke from NCL ICB, who along with key partners developed these new protocols. So very contemporary, very pertinent, often perennial issues in the national safeguarding system. So we hope these protocols give more confidence for practitioners in assessing bruising in mobile, non-mobile children, and it is in non-mobile children that it is particularly a struggle. So I hope that helps. Okay, right, Karen, Red Llama, we've got a few minutes left. Is there any other closing comments you'd like to make before we conclude?
Yeah, I mean, the concluding message that I have is that not only high-risk cases, you can refer high-risk cases to MARAC, but remember that we have our Solace advocacy and support services for low and medium risk. You can call them as well for advice and support if you're not sure whether it is a high risk or not. And even if it's low risk, if it escalates to a high risk, they will bring it to the MARAC. So please make sure that all our multi-agency services are used, and we have specialist services that help at the one-stop shop, like Asian Women Resource Center, Jewish Women's Aid, and Romanian hub also, we work collaboratively with them. So we make use of all our specialist services to be able to have that multi-agency approach to respond to our survivors and support them effectively.
Wonderful. Thanks, Red Llama. Michaela.
Yeah, just really wanted to say, kind of on the back of that, having the Early Help IDVA based with us partly in the hubs and coming to our Early Help panel every week has been just a really fantastic enhancement to our work with BORG. We're just getting really informed information for cases coming through panel into Early Help around, you know, whether the mother or the survivors had the safety planning, who's involved, whether it's going to MARAC, really good communication, but also Lena, our Early Help IDVA, has been coming out on home visits. She's been having conversations with families where it's quite a tricky conversation alongside our practitioners, available for consultation. It's just been really, really positive. So just a big thank you, really. And I know that that's part of the wider package with having an IDVA based in social care and with the MASH as well.
I'm glad to hear the impact of the IDVA within your service. And we also have brought in IDVA now within children's social care, which we hope to see good impact as well.
Brilliant. So Lena's going to be coming to our next management meeting and being start visiting the other two hubs. So she started off in East Central because she's right next door to her office at Tarling Road Community Centre. But the idea is that she's going to actually spend time co-located in West Hub and South Hub, and she's meeting with our managers next week. So yeah, really positive. And the other thing was we had a really good team meeting with my hub that Lena kind of co-facilitated with our local IDVA, our local trained IDVA, where we had, I think, 5 VORG organisations coming in and talking to our 0 to 19 practitioners and really informing us of what they do. And my last point, just on reducing parental conflict, is to say that we've got 3 more sessions of our workshops coming up. One is bespoke for the police, and I think that's the very first bespoke training we've done with the police, so we're really excited about that. And the other 2 are bespoke for school-based staff and their twilight sessions. But my feedback on the previous workshops we've had is the attendance has been really good from a really wide range of agencies. So thanks everybody who's been part of those.
Amazing work. Thank you.
Thanks.
Great. Thanks, Michaela. Thank you so much. Okay, right. Well, that's the end of the webinar. Like I said, if your email address is in the chat box, you'll get a copy of the slides by the end of the week. And I will put a recording of the video today, the session, on the website for you to share. Thanks for coming. Great to see you all, and see you at the next BSCP webinar. Cheers.
Thanks.
Thank you.
Thanks, Tony. Thanks, Red Llama.
Bye. 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 Bye.
Bye.
Thank you, Tony.
Cheers all. Take care. See you soon. Stop the recording.